Okay, so the subject today is going to be abuse and stress as causes of chronic pain syndromes, I'm Dr. Rutherford, certified functional medicine practitioner, chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So this is, we haven't talked much about the subject at this point in time, but this is a great topic to choose because I do the intakes as far as when patients come here seeking help to determine whether that patient is a qualified candidate for what we do. In other words, if they come in here and do what we ask them to, are they going to get better? And in doing so, there is that initial history of trying to determine what are the genuine causes of this person's chronic condition. And I can only speak for myself as going through this from beginning to end, becoming a functional medicine practitioner, being involved with lots of people, had a lot of different ideas on what was causing what, and sifting through those and eliminating some and embracing others. I think all along the way, people kind of understood that stress was a problem. I think it goes to the alternative mantra of you can't fix, the adrenals, you can't fix anything. Most people, I think even throughout my life, have said, oh, that person got cancer because they were stressed, which isn't a very nice thing to say. But people would say that. It was almost like a criticism of that person. Like if they didn't get so stressed, they wouldn't have cancer. The point of that being, all along the way, there's been an awareness somehow that stress is not a good thing, and that stress can make people not feel well. But I must admit myself, I never totally got that our patients were more than stressed until we joined forces, and the functional neurologists had already been on this before the functional medicine practitioners, from the perspective that, and the way I saw it, I'll just tell you how I saw it. We've never had this conversation, but when you started doing like migraine headaches, and it became obvious the key was to kind of reset that overfiring stress mechanism in the midbrain, that the light suddenly went on for me. It was like, oh my God, our patients aren't just stressed, but they're they're in some sort of chronic fight flight, or you might even say some degree of post-traumatic stress syndrome. And then as I got to chat with Dr. Gates more and more, and the research that they use, and maybe that you ultimately also investigated. I'm just saying it because I don't know what came first or whatever. I started to ask people, as we would pick up, I thought I would pick up some neurological signs as the patient was sitting there, that they were probably in fight flight. I would always look down at the paper, and I always say, well, what causes this can be, part of this can be your stress, and people inevitably are like, well, I'm not really stressed, or I can handle stress, or stuff like that. And a lot of times people acknowledge what I'm saying, but I'll usually follow that up by saying, I'm not saying that you're stressed. I'm not saying that you can't handle stress. I'm saying, I'm just sitting here and you have 5 signs that your brain is overfiring. And then I'll usually look away and say, what we see in this frequently is physical, verbal, sexual abuse, something like that. And I try to look away, so I don't want to put pressure on the patient to acknowledge it. But up here, almost like 97% of the time, the patient's sitting there going like that. So this is an incredibly, I think, prescient and good topic, because it's one that, and the point I wanted to make is that even people who have it and are sitting in front of me and terribly want to get better, when having this presented to them, still, I don't know if it's a public stigma, still say, well, I can handle stress, or I'm not stressed, or maybe they don't realize, what's going on. But generally, by the time we're done with the consult, they're usually comfortable. They're usually comfortable, may not be the word. It usually gives them some relief, and they usually kind of embrace it and say, oh my God,
I think you touch on a good topic.
That makes so much sense.
Because I think there is a huge stigma associated with stress. I think it's almost looked at as a sign of weakness. If people are anxious, if they have anxiety responses. So a lot of people are going to say, no, I'm not stressed. I'm not stressed, you know, in a very defiant manner. But really, we have to kind of just take a step back, relax, and open up with that person and say, okay, well, these are the effects of chronic stress, and maybe those are driving factors behind your chronic pain. And that's really the impetus for today's broadcast, because we need much, much, much greater awareness about these issues, not only abuse, but about stress as these driving factors for chronic pain, because as we've talked about in other broadcasts, 130 million Americans at least now are estimated to have chronic pain.
And as we sifted through all of this, I mean, years ago, I mean, there was stress and there's parasites and there's having all the causes of chronic pain. The underlying causes that we've come across, and I defer to you to expand on these if you'd like. I mean, we've come across thyroid problems seem to be epidemic, particularly Hashimoto's. You're probably sick and tired of hearing us talk about digestive bowel problems in the gut, if this isn't the first time that you've watched us. And the research and the scientific evidence on that continues to expand. Autoimmune problems certainly have become now at least somewhat obliquely embraced by the medical profession. I'm getting a lot more patients now that come in. I had 2 yesterday, and they said, yeah, I was told that it was probably autoimmune, and they didn't, then they just kind of glossed by it, not knowing really what that meant or how to address it or things of that nature. So, but stress, this particular type of stress, this particular type of kind of, like, I use the term again because sometimes people can't embrace it, and different people have different ideas what the definitions of like a post-traumatic stress syndrome is. I mean, there's levels of severity in everything. And like fight, flight, post-traumatic stress syndrome, good example is you have sweaty palms all the time, you have sweaty feet, you're clammy, you can't go to sleep, you wake up, you can't go back to sleep. These are some common signs that you have this. You close your eyes and your eyes are a little fluttering a little bit, stuff like that, called blepharoplutter. These are signs that you can see in a person sitting there, and you know that their body is producing stress hormones as we're sitting there. Of course, they're nervous, and of course, they're hoping that we can help them, and so on and so forth. So, did you want to elaborate on the causes of chronic pain?
Because I think it's interesting for people to kind of get some perspective. You've been doing chronic pain since 1979, 1980 in Reno, Nevada.
Yeah,
definitely 1987. I know is when you really went at your chronic pain practice, and you've had musculoskeletal practice, you've had scoliosis, and so in terms of the myofascial musculoskeletal component, Dr. Rutherford was all over that for decades.
We had people back there get off of wheat and get better, and it was like, what the heck? How could that be?
Right, and what
in 1987,
I think is, deserves applause is the fact that you would look at the car accident patient who developed fibromyalgia after the car accident, and in the insurance world, you're going to be told that you're faking it, so to speak, to put it nicely, if you develop fibromyalgia after a car accident. But now we know the scientific reasons why that happens, even though still in a court of law, it's looked at with a lot of stigma. Nonetheless, that stigma has really kind of transcended into the world of fibromyalgia. And when Dr. Rutherford and I joined forces in 2009, and from that point on, we were treating and evaluating a lot of fibromyalgia cases. And though we did not know what we know now, we had the fortune to see patterns, because so much of medicine and diagnosis relative to whatever your treatment modality is, whether it's a drug or an herb or a brain exercise, is pattern recognition. And what we saw with these patients.
And for the record, for those of you who haven't seen this before, I have fibromyalgia.
Yeah. And so what we saw was that there are these unifying features, but there are like 3 different columns of causes for fibromyalgia patients, basically. And what we observed them to be was abuse and childhood maltreatment was number 1. So we kept doing these interviews, and we kept talking to patients about their stress levels. And as Dr. Rutherford said, 97%. I think that may be a little bit too high of a statistic.
Do you really?
Yeah, I do.
I mean,
I'm not criticizing you.
I'm not exaggerating in my view, because I hardly ever have anybody who doesn't shake their head yes when I say that. So that's where
right. Okay, gotcha.
Occasionally somebody will go.
He also sees a different patient population than I do, because you do all the intakes and I do all the examinations. So maybe we have a different patient subset flowing into the examination. But I'll say, in our experience, is probably somewhere around 70 to 80% of the fibromyalgia patients that come into our clinic Now that's a little bit higher than what we see in the literature, but that's what we've seen, have been exposed to childhood abuse. So pretty high. Frankly, it's pretty dang high. And so we said, wow, okay, so there's that connection. And then we started seeing the connection with the thyroid, and that had been discussed, but then we started to see the connection between autoimmunity to the thyroid, and that was validated many years after we were seeing this, and that was validated in 2014. And then we were seeing patients who had fibromyalgia who all seemed to have these signs that their pain nerves were dying and degenerating. It's called small fiber peripheral neuropathy. And that became validated, gosh, I think it was November of 2013, but really 2014, it really picked up a lot of steam into present time. And so those were the main unifying features of fibromyalgia. And what we have to do with fibromyalgia and other chronic pain syndromes is step back and say, okay, why does this person feel pain that seems semi-disproportionate to the level of tissue injury? So many patients come into our clinic and say, well, my MRI is normal, but my back still really hurts. Or I have this pain all over my body, but my blood tests are normal. Heard that before? And so we started delving into it and figuring out that at least half of them have small fiber peripheral neuropathy. Mm-hmm. So if your pain nerves are damaged and dying and sending abnormal pain signals to your brain, well, that's one good explanation why you're feeling so much pain. Or if you're the fibromyalgia patient, you're just achy all over and you're really fatigued, and no one's really assessed if your immune system is attacking your thyroid at too high of a level, independent of what your blood tests show relative to your thyroid. So everybody's going to say, my thyroid test was normal. Well, what we're telling you is that you probably had two markers run for your thyroid, looking at one hormone coming from your brain to your thyroid and one hormone coming out of your thyroid. Most likely you haven't had the immune counts done to your thyroid. And if you have had them done, there's also a good probability that the correct criteria established by the Mayo Clinic was not used in evaluating whether they were significantly elevated or not. And then lastly, we have the whole stress piece. And so what we find is that when patients are under chronic stress from childhood or repeated abuses later in life from a spouse or partner, or your job, that these heightened levels of chronic stress the human being is not made to endure. And what it can happen is that the stress hormones can actually make you more sensitive to pain. The stress hormones can cause a variety of other neurological consequences, like leading to depression and anxiety, being associated with that, functional gastrointestinal disorders like IBS, which we talk about the gut a lot, as well as disrupting your sleep so that you don't sleep well. When fibromyalgia patients or chronic pain patients don't sleep well, what we know is that the lower brainstem, which makes chemicals like morphine to shut off pain, that doesn't work as well. And so as a result, this balance between pain and mechanisms in your spinal cord that shut off pain, that imbalance comes out. So you just start feeling pain all the time. People feel the shirt on their back. People feel pain when their husband hugs them. And that's a big reason why. So all of that has to be evaluated in the context of looking at a chronic pain patient. So now you can see the stage that we're setting for those of you who've been exposed to chronic stress and chronic abuse, and we can kind of show you really what's happening there relative to your illness.
And just to add to what you just said, what has to be evaluated relative to a chronic pain patient, just to share with you some of the things that really cognite with patients. I mean, once you get this chronic stress hormone going, you're not just putting out like adrenaline, you're putting out cortisol, you're putting adrenaline, noradrenaline, glucocorticoids. Most people don't realize that the stress glands also help to control your blood sugar by moving sugar out of your liver. You're putting out mineralocorticoids, you're putting out epinephrine, remember, no EpiPens and norepinephrine, thing like that. So, I mean, this is a massive shot to the body to create energy so that you can deal with trauma, so that you can deal with emergencies, so that you can deal with danger. And some of the other more specific things that seem to cognite with people is these stress hormones are one of the factors that contribute to short-term memory loss. They're one of the factors that contribute to, as Dr. Gates already said, can't go to sleep, wake up, can't go back to sleep, insomnia, brain fog, as I've learned in the last year from reading your stuff, that it can actually create immune inflammation that can cause, if I read it correctly, Hashimoto's. Dr. Gates talked about gastrointestinal problems. When you're in fight, flight, and you're like supposed to fight the bear or run from the bear, you don't need to be peeing, you need to be pooping, and you need to be thinking about sex, because everything's being put to your arms and your legs and your head to run to get strength. So what happens? Your sex hormones are decreased because the chemicals that are making your sex hormones that go to your estrogen, ovaries and make your estrogen are being used to make stress hormones. Chronically, this causes low libido. It can cause just about any type of abnormal period you can imagine, absent of pathology, absent of tumors or fibroids or something like that. The vagus nerve, chronically, it shuts down. So that shuts down your gut so it doesn't move as well. Decreases blood supply to the gut. You wonder why you get a gut problem. This is like the massive end effect of, like, short term, you might get little butterflies. Long term, you're trying all these diets and the diets aren't working. The reason the diets aren't working because your gut's being flooded consistently with all of these stress hormones. You also get inflammation on the inside of the gut because of the adrenaline or the cortisol, or both.
I'd say the cortisol breaks down the intestinal barrier.
And then, as Dr. Gates already went into, all these people taking these antacids, it decreases your hydrochloric acid in your stomach. So now you don't have enough hydrochloric acid. So what do? They give you an antacid to kill the rest of it, which is off to the races. Gallbladder starts not ejecting properly. Now you also get pancreatic enzymes that aren't getting the signals, and the gallbladder is not getting the signals from the stomach, which isn't making enough hydrochloric acid. And when I said I realized that our patients were more in this pattern, then I'm just stressed. Now you pull all of that out and you have a fibromyalgia patient sitting in front of you, or you have a chronic fatigue patient sitting in front of you, or you have a Lyme patient sitting in front of you. Now you take all of that out and you put that up against that Lyme patient, and how many of those things do they have? So you have to consider how profound this stress mechanism can be in any case. And not all of you are going to have all of those symptoms, okay? But the reality is, if you're not assessing that, you have zero chance of getting better, but even more so, I would say you have less of a chance of staying better.
I would agree. So really, relative to the chronic stress response and the discussion of chronic pain and fibromyalgia, we can go to, when we do these broadcasts, you can access them through powerhealthtalk.com, not only just through YouTube. And the reason why it's good to go to powerhealthtalk.com is that you can watch the broadcast, and we have links below where we get all of this information. Usually we attach between 10 to 20 to sometimes 100, literally, research articles to the topic, depending on the breadth of the topic. Today is a little more focused, so I think we had 12 articles, but they're action-packed and they're really pertaining highly to this discussion. So the journal Pain just came out in 2016, looking at 3,081 patients with chronic pain, and they found this huge association, again, not surprisingly, between those who are under chronic stress or those who've been exposed to abuse and their chronic pain, or their fibromyalgia-ness is how it's termed now. So they're seeing this association. The more stress you're under, the worse your pain is. And then we attached article after article after article examining prevalence statistics between those with fibromyalgia and basically the percentage of them who have been exposed to abuse, maltreatment in childhood, so on and so forth. And the statistics vary somewhere between, the low end is 30%, which we've seen in other research estimates, but there are a lot of research studies citing 60 to 64%, somewhere in there, which is on board with what we see. And what we think happens is that a lot of patients, if you ask them the first time, have you been exposed to abuse in childhood, and even how you ask the question, frankly, lots of times people say, no, I wasn't exposed, because they don't really want to talk about it. It's potentially one of the most painful things a human being can be exposed to. And then they don't really want to conjure up those memories. Frankly, sometimes people suppress those memories through protective mechanisms. Basically, when you're under so much stress, your brain will actually forget what happened. And so learning how to ask the question politely, softly, respectfully is really, really important as a clinician. And what we found is that a huge percentage of our fibromyalgia patients and chronic pain sufferers have been exposed to abuse or under perpetual chronic stress. So perhaps you're in a relationship and it's just abusive. Perhaps you feel that you're with a predator. Or perhaps you feel that somebody doesn't just understand you and you feel bossed around and you feel like you don't have any voice. Maybe those are on the continuum of less severity, but it is important. And all that has to be paid attention to in our experience, frankly, for a fibromyalgia patient to get better. And while in the medical community, we've done broadcasts on how the medical rheumatologists, lots of times, they don't want to see you. And it's nothing against rheumatologists, but we've
The fibro patient.
the fibromyalgia patients, we've cited that they don't want to see you because they feel that you're just faking it, you're whiny, they don't know what to do with you, they don't have any good medications, in their opinion, that are really, really effective for fibromyalgia patients. The current studies show that exercise is probably the best thing comparing medications versus exercise. Exercise is actually more beneficial, but as many of you know, you can't exercise because you're in so much pain and you're fatigued. So that's kind of the data on this issue. And we just want to bring more attention to it. We have a lot of doctors who watch these broadcasts as well. So we want them to gain more awareness and acceptance of these problems because frankly, we have a chronic pain epidemic. And as we've talked about in previous broadcasts, the current agenda is just to create more green belts for people to exercise. And the problems are far more complicated, far more involved. Many areas of your physiology, as Dr. Rutherford said, from your gut to your thyroid,
I forgot chronic urinary tract infections.
Yeah, to your bladder, to then the reciprocal effects of these chronic stress hormones and what they do to your brain, to damage your brain, to keep the whole stress cycle going. So that's what we want to outline. And if you want more data on this too, we've done several broadcasts. I'm not wrapping up yet, but we've done several broadcasts on is irritable bowel syndrome, irritable brain syndrome. So you can go look at that and see where we just talk about that for a half hour to 45 minutes. And we've done many broadcasts on the different effects of stress hormones and depression and stress hormones and the adrenal glands. So you can kind of put this web of physiologic dysfunction together for your case so you can kind of figure it out and then go at a treatment plan to better improve yourself. So,
yeah, and I would just mention fibro many times, but I mean, this is a factor across the board for dizziness, chronic vertigo, chronic migraines for sure, restless leg syndrome, chronic anxiety, maybe even those of you who have heart palpitations, but gut problems for sure, peripheral neuropathy. I mean, not to give the impression that it's primarily a fibromyalgia issue, but it, I mean, and I would say maybe it's not as high a percentage in those other types of conditions, and you correct me if I'm wrong on that, but it's a perpetuating, it's not just a causative, perpetuating factor across what percentage of the conditions that we treat, would you say?
I mean, it just varies from condition to condition because like with fibro, it's so integral to our diagnosis, 80% in our clinic. Whereas with dizziness, psychophysiologic dizziness, for example, is the most common cause of dizziness. Now you hear psychophysiologic, you think, well, they're just crazy. That's what I've been led to believe. You're not crazy. It's basically an anxiety-induced dizziness. And that's the most common cause of dizziness on the planet. So that is very important there. Peripheral neuropathy, I'd say probably less of a percentage, but absolutely with migraine, stress is always a common factor, even though everybody says, well, it's not a tension headache, it's a migraine. But what we're finding is that muscle activation patterns through the Botox study, so they're giving migraine patients Botox and they feel better. Well, why is that? They're relaxing the muscles, which are probably contracted secondary to chronic stress responses and pain. So you have to look at all these factors and you have to really take a step back from just putting a label on things, which is the diagnosis, as you've been talking about forever, versus stepping back and looking at the function of the problem. And when you look at the function of the problem, why does somebody have migraines? Rather than just us saying, migraines, you need to go get Imitrex from the neurologist, where I say, we have migraines, but perhaps you went through major stressor when you were younger that led to your gut breaking down, your immune system is hyperactivated to your thyroid, the immune inflammation is going into your brain, resulting in these headaches. Different way of looking at the problem. So anything else you wanted to?
No, I think I'm good.
Add in? Okay. All right. So again, you can go to powerhealthtalk.com, look for the references. If you have any questions relative to topics you want us to cover, send those to us. We can't answer your personal questions because we just cannot answer hundreds of thousands of personal questions. But thank you for watching, and we'll see you next time.